Good morning, my good friends and followers. Yes, I wish to bring this information to you so that you will take appropriate measures and important steps in trying to prevent the condition. Now, the condition is ovarian cancer. Oftentimes, people don't usually talk about ovarian cancer. Now, you'll be wondering why everybody is talking about cervical cancer and nobody talks about ovarian cancer. Now, the reason is that cervical cancer is a cancer that is located where it is readily accessible, it can easily be screened for, and treatments offered. While ovarian cancer is hidden within the tummy, within the abdomen of the woman. So it's difficult to assess it without opening the patient up, even with images, ultrasound, and CT scan, and MRI, and the rest of them. Now, by the time the ovaries are engulfed in cancer, it would have advanced. So that is the reason why most people do not talk about it, because we know that by the time the woman presents with symptoms, usually it would have been advanced, and at that time only treatments can be offered. It may cure may be very difficult. So, but I wish to bring to you various early symptoms and signs that um, when you see, you should visit the gynecologist for early treatment. You know, now once you begin to have bloating, you are a woman above 50 years. Once you begin to notice that you are having bloating more frequent, is one of the signs that will make you to go and see a gynecologist for proper evaluation. Number two, if you notice that you get easily filled when you are eating, you know, with little food, you get easily filled, it's a sign that you should see a gynecologist for evaluation. Number three, if you start feeling abdominal pain, especially in the lower part of your tummy, or pelvic pain, it is time you should see your gynecologist. Okay? Now, if you begin to have frequency of micturition, you urinate more frequently than you usually do, it's a time to see a gynecologist. Or if you start having urgency, you know, you've not been having pressing need to urinate very fast, and all of a sudden it starts happening to you, these are signs that you should see a gynecologist for clinical evaluation. Now, all these symptoms I've mentioned, you know, they are also caused by other um, health challenges that an individual can have. So it's not necessarily ovarian cancer. But why we are talking about it at this point is that if you go early, when you begin to notice these symptoms and signs, it is better it is diagnosed early and treatment offered. At that point, it may still be cured. But if you wait until you start having enlarged tummy, with protruded tummy, where everybody will be, everybody will start asking you whether you are pregnant, or when your legs start swelling up, both the legs start swelling up, or when you now begin to lose weight, or when you start having severe tummy pain, or start bleeding vaginally. These are features of advanced condition. So, and why we are saying you should present early is so that if assessment is done and it is found that it is not ovarian cancer, then you are free. So that's exactly what I said. Let me bring to your notice why people don't usually talk about it, because it appears to be difficult to identify early. But once you begin to see some of these signs, please report to the gynecologist. Thank you, and do well to follow us on Facebook, Nabo Jampo, and also